Hey, hello, Don here again. This time with a brief precaution regarding mental health care, psychotherapy, psychiatric care, the whole realm of people who are seeking assistance for some type of mental or emotional problems. Briefly, in the past, I mentioned that my own undergraduate background was in pre-medicine. At the graduate level, I chose to go into psychology. So I'm somewhat sympathetic to medical aspects, physiological aspects of health conditions, including mental health conditions. For example, one of my posts and videos is about the subject of anxiety, and I pointed out in the case of anxiety, a person's heart condition should be checked out for a couple of reasons. One reason, people with anxiety sometimes are troubled with a heart condition, palpitations, AFib, heart conditions that cause sense of anxiety, and the treatment or the pursuit of mental health care should be comprehensive, including an evaluation of a heart condition. But let me take this a bit further. Now, stepping outside of mental health for a moment, if you had a heart attack or heart condition or heart pain, you would go to a physician and they would evaluate your heart. They might take pictures of your heart. They would test the heartbeat. They might do an MRI of your heart, a CT scan of your heart. If you had an injury to your leg, most likely they'd take a picture with an x-ray of your leg. They'd take a picture of the organ that is causing you pain. The same with liver, pancreas, stomach, whatever. But it's somewhat interesting, that when we get to the mental health issues, we're talking mental, which brings up the issue of mind, which brings up the issue of brain. And it seems to be one area, and basically if it involves the brain, detailed involvement of the brain should involve the field of medicine, and the specific field of medicine is psychiatry, neurology. How many people, whether they're in mental health counseling, psychology, psychiatry, social work, how often is it that the person goes and says, I'm suffering depression, I'm suffering anxiety, I'm suffering obsessive compulsive disorder, whatever it is that they're suffering, whatever that pain it is. We consider it a, quote, mental illness, a mental condition. Question is, how often is the brain actually examined? And this is especially irresponsible if a person goes to a psychiatrist and said, I'm terribly depressed, I've been suicidal, or a person with obsessive compulsive disorders, I just can't stop counting things, I can't stop washing my hands, or a person with anxiety said, I can't even leave the house anymore. And that physician, psychiatrist may just slide a prescription across the desk and say, here, try these for a while, take these. And if you're a mental health counselor or a psychologist, you might say, hey, I think this person should see a psychiatrist, and send the person off to a psychiatrist. And that psychiatrist very likely, most likely, will not do a CT scan of the brain, an MRI of the brain, any examination of the organ involved in the illness, but may in fact reach in for a prescription and slide it across the desk. Try these pills for a while. And if you're a mental health counselor or psychologist and you have a person with depression and haven't involved or even questioned the need for a thorough medical evaluation, which would include psychiatry and neurology, and which should include pictures of the organ involved, CT scans, MRIs. We don't know how many people are troubled with so-called mental disorders that in fact may have some type of an anomaly in their brain, from a small tumor to an aneurysm to a malevolent tumor to a benign tumor to a bleed in the brain, or a brain that was genetically or had don't make me say this twice, hereditarily troubled and displays itself as a mental illness. Point is, if we're dealing with mental problems, we're dealing with the brain. And like a heart condition, leg condition, liver condition, stomach condition, someone should take a picture of the organ that's involved. Thank you. Please subscribe to this if you will. Look at my other, some of my other videos, and most of them deal with a precaution regarding seeking mental health care, some of the deficiencies in mental health care, and for me, this is a pretty big one. And by the way, this was brought to my attention, clearly brought to my attention by a comedian, a stand-up comedian, and said, hey, isn't it kind of funny? You go to a doctor for your heart or your leg and they take pictures. You go to a doctor for something wrong with your brain. Nobody ever takes a picture of your brain. That's what prompted me to make this video. Thanks for listening. My name is Don Degley. I'm a retired clinical psychologist. I'm not here to provide therapy. I'm only here to provide precautions, some advice for those who are crossing that threshold into a mental health office of some sort. Thank you. Have a good day. I was trying to think of some other advice I might give you. When you're reheating pizza, spray it with a little bit of water before you put it in the oven. It'll help cook it without burning it to a crisp. My mother told me that a long time ago, and usually she was right. Thanks. I'm going to turn this thing off. See you later, I hope.